I'm Leslie Ferrens. I'm a respiratory therapist at Children's Medical Center, and I work in the emergency room. Our bronchiolitis clinical pathway team, comprised of doctors, nurses, respiratory therapists, and educators, looked at ways to streamline the care of children with bronchiolitis. Recognizing that proper bulb suctioning can keep a child from being hospitalized, we spent a lot of time discussing this intervention. It became clear that our current education was a bit inconsistent, and our bulb suction techniques varied widely across the hospital. Consequently, parents were leaving the hospital without a good understanding of how to take care of their children at home. As a result, parents were often bringing their children back to the emergency room with symptoms that could easily be managed with bulb suctioning. What we needed was a renewed focus on the bulb. The bulb. So, we embarked on a mission to create educational materials for everyone, parents, families, and staff. We produced a video that demonstrates proper bulb suction technique, including ways to hold or restrain a child so as to keep little hands out of our way. This video is being used to train nursing and respiratory staff housewide and emphasizes the need to have parents return demonstration. This same video has been adapted to be used for parent education, both in English and in Spanish, and is available on the hospital intranet and will be migrating to the in-hospital education TV channels. Our goal is to provide the proper tools to allow parents to care for their child at home and also to reduce return visits. Go bulb!
Over 1,000 patients are admitted with bronchiolitis at Children's Medical Center, Dallas, and it is very important to educate families about what their child has and what they can do to prevent it. And this video has clearly outlined and defined how to do suction on a child. The video involves suction of an infant and an older child. It gives a clear visual of how to suction. Often at hospitals we give parents written instructions and assume they understand, but it is one thing to give something in writing and another to show a video in a sort of a visual on how to do a suction. When I saw this video for the first time, I must say as a provider, I was amazed at how beautifully this video was done and how much we as provider didn't know what it is to do the correct technique of suction. And this is not just my own impression, but many providers since then have commented on how much they have learned. And it has not just educated the families, but also taught the providers the correct way of suctioning. So this really has impacted how we do suction, because suction is something which is necessary on all the patients with bronchiolitis. And it can streamline care, it can reduce hospitalization. And this video has impacted our practice and streamlined our education across the organization.
My name's Andrea Bracken. I'm a respiratory therapist at Children's Medical Center, Dallas. I work in the emergency room. Many parents, we find, have never been shown how to bulb suction. They've been given the bulb when the baby was born and said, here, clean out their nose. But as the child gets older, there's no way to, they've never been shown how to do it effectively. Showing the parents age-appropriate techniques and showing the parents the correct way to aggressively bulb suction their child, and then letting them get hands-on experience with encouragement and corrective instruction has been very beneficial in letting the parents go home, take their baby home, and manage their baby's bronchiolitis, congestion, illness at home without having to return to the hospital.
Hi, my name is Jennifer Pemberton. I'm one of the nurses in the ER, and the bulb suctioning video has taught me how to perfect my bulb suctioning technique and to also more effectively teach the parents on how to manage their children's care at home. What I really liked about the video is that it talked about different positions you can safely put your child into bulb section, and it encourages the parents to take ownership of their children's care at home. The parents are very excited about the easy techniques that they are able to incorporate in bulb sectioning. They're excited about the fact that it's easy to hold the child down or wrap them up, and also about saline. Most parents never knew to use saline drops for bulb sectioning. They're also very thrilled to find out that you don't have to bulb section for an hour. You just have to bulb section effectively, and it can be quickly. Especially with the video, you're able to learn the proper techniques to bulb section effectively and faster.
Hi, my name is Kami, and I'm a ED nurse at Children's Medical Center, and I've been a nurse for almost 17 years, majority of that with pediatrics. This is my first year in the ER. I have lots of experience, including ICU, but this is actually the first time in all my experience that I have learned the correct way to bulb suction. Up until this past year, and I've seen the bulb suction video, I always thought the way to really get the secretions out, especially those thick RSV secretions, was just to deep suction. Get in there, get it all out. Well, that you can't send a kid home in deep suction. And how can you teach the parents that they're going to be okay taking their kid home when we've just suctioned them with this contraption they don't have at home? So watching the video that the respiratory therapist here at the hospital made really not only taught me proper technique, but allowed me to talk to the parents at their level, so I could comfortably teach them and they could learn, and learn quickly, so they could do a return demonstration, and the parents, as well as myself and the physicians, the whole team, felt comfortable sending this kid home with a respiratory virus, knowing this kid's going to be suctioned really well. And I've seen marked changes. I've seen kids come in working really hard, retracting, and you're thinking, oh my gosh, they're going to be admitted for sure. And you get those thick secretions out, you clear their airway, they're eating again, they're pinked up, they're, no work of breathing, and, everyone's happy. But just, having that knowledge to be able to share with the families really makes me know that I am doing that patient a real strong service, because I know they're going to get the care at home that they need to get better.
All right, I remember one day when we came back from the doctor's office and my son had RSV, and we felt very helpless because we didn't know what to do for him. And they told us, that it would have to run its course, but he continued to get worse. And no one had ever showed us, the doctor's office had never showed us, when we had our son in the hospital, nobody showed us originally how to do this suctioning with this bulb. They sent us home with one, but we really didn't know what to do with it. So we would just use it, just kind of stick it in his nose. Well, it continued to get worse. And so we were able to get in with Children's, and their staff was amazing at Children's Hospital. They were able to get us in. They were able, with the respiratory therapist, they taught us step by step how we suction our child's nose. So the respiratory therapist actually had me sit him and place him between my legs. And at first I was so intimidated, like, I can't do that, that's my child, he's crying. But they were just so gentle. The staff was wonderful. It just encouraged us to continue, and then I practiced it with my child. They allowed me to do that and did step-by-step instructions on how to do that. And once they took me through that, the respiratory therapist says they showed me how to do that with my child, I realized this is something that is going to work for us. The staff at Children's and the respiratory therapist worked with us because it has saved us enormous amounts of medical bills. Since every time he gets a little sniffle, he knows what's coming. We're getting the bulb out. And in fact, he even expects it, and he knows that it makes him feel better. Even as a 2-year-old, we started this a year and a half ago, and now it has been amazing. And what a great tool this is, that I hope that every parent is taught this and learns this, because it is just amazing the difference between your child being sick and your child having a great healthy lifestyle.